you heard about Ozempic and ever wondered, should I take it? Or maybe you're stuck on how to get over that chronic illness that's hindering your life. Whatever internal challenge that you're facing, I got you covered in today's powerful interview. Hello and welcome back to A Sharper Life. I'm your host, Nikki Sharp, a two-time best-selling author, wellness expert, and transformation coach. And I want to just say, if you are a returning listener, welcome back. And if you are new here, it is great to have you. A Sharper Life is not your typical self-help podcast. It's a refreshing take on personal development with laid back and genuine vibes. Each week, I share episodes ranging from solos where it's just you and me, and I share a behind-the-scenes look into my life, tools that I personally use to navigate challenges, and tips that are guaranteed to transform your life. I also mix in interviews with world-class experts such as Sheila Kelly, known as the Body Whisperer, Dr. Daniel Aneman, and Jim Quick, who specialize in brain health, as well as relationship experts and Tantra teachers, and everything and everyone in between. I know that you are going to love the show, and the only ask I will ever make is that you take a quick moment to click that subscribe button. This helps the show to grow and makes it possible for me to provide the world-class interviews as well as the weekly solo episodes. Now, I wanted to take a quick moment to highlight a recent interview by Marissa Mermaid. And she says, soulful, real, helpful podcast. One of the best podcasts that keeps my attention and offers easy tips, action steps toward a more meaningful life. I've been tuning into these sporadically on my daily walks. Nikki speaks in a direct way that vibrates to my soul. You can tell this is part of her life's work, and she's genuinely here to help. Such a gem. And I want to say thank you, Marissa, for sharing that review. I love hearing what you enjoy about the show, and I appreciate everyone that listens, subscribes, and has left a review. Now, today I have a very special interview with not only a close friend and a former Ultimate Transformation Program graduate, she is a powerhouse when it comes to the world of helping you transform your health from the inside out. Dr. Brooke Stubbs is a double board certified internal medicine and lifestyle medicine physician with a master's degree in nutrition. She is the founder of RootedFemme, a concierge practice that focuses on lifestyle medicine. Brooke believes that by addressing the root causes of disease, we can prevent and reverse chronic illnesses and improve overall well-being. And I just have to tell you, today's episode is going to blow your mind. Brooke is such a powerhouse when it comes to everything related to Ozempic, and you better believe it, we talk a lot about that. She is giving her tips on it, who should take it, who should not. We talk about food, ways to reverse illness, and so much more. So get ready to take some notes with Dr. Brooke Stubbs. Brooke, it is an honor and a pleasure to have you on A Sharper Life podcast. You are not only a friend, but a former client from UTP, which I'm sure we'll get into. But I'd really like to start off on your journey on what actually made you decide to open this concierge, I guess, program, everything you're doing, the services, because you do have a very interesting story coming from being a doctor and a resident. And I think it'll be fascinating for those who are listening. So let's start there.
Yeah. Thank you, first of all, for having me. So to answer your question about how I got into this kind of practice, I was a resident at, my early 30s. I should have felt great, been in the prime of my life. I was about to, try to conceive a child, and I felt terrible. I had terribly painful periods. I had endometriosis. I had to go through IVF. I was totally anxious, very irritable, headaches consistently, gaining weight, which was difficult to get off. There was a whole lot of things that were quote unquote normal, but I just didn't feel great. So of course I go to my physician, who was a preceptor of mine or a supervisor of mine who I really loved and respected. And she was, very well respected within our community and very smart. And I went to her and she kind of did the normal screening, labs, vitals, and EKG. And she said, "You look great. You're healthy. What are you doing here?" And I realized that she didn't have the tools to tell me how to live a better life, how to be healthy, how to promote my overall lifestyle so that I could live well, right? And I didn't, at the time, I was just like, okay, I'm in residency, I'm not sleeping well. It's just a hard, stressful time in my life. I'll just keep going. So I did that and I kept on this same train for years. And I ended up being a hospitalist after residency, and I'm working on the bone marrow transplant unit here in South Austin. And it was a wonderful place to work. I had great coworkers, but it's stressful and I had a high burnout rate. And, in 1 week, I had a colleague who died of a massive stroke. He was a well-respected surgeon. I had another colleague who was a cardiologist who had a massive heart attack after a marathon. And I was pregnant. I think I was 6 weeks pregnant with my second child, both conceived by IVF, by the way. And I was having chest pain, and I had already been introduced to lifestyle medicine, and I intuitively already knew that there was a lot missing, a gap in the healthcare system that helped us to be well instead of just waiting for us to get sick. And I thought, you know what? I need to take care of myself. I'm watching these cancer patients eat terrible nutrition that is provided by the hospital. And I know there's something more I can be doing for them. And I need to take care of myself in order to do that. So that was the first thing. I had to get out of there. I had to take care of myself. And so I did. And that was right before the pandemic hit. So I was really focusing on my lifestyle. I protected my sleep. My 8-hour sleep opportunity became sacred to me. I really lowered my stress, lots of meditation, lots of just feeling into my body and figuring out my anxiety and seeing other practitioners about that. And changing my nutrition. And when I did all of those things, and I know you know this, but I went completely plant-based. And after, there were some cravings while I was pregnant, but after pregnancy, I got rid of all of the processed foods in my diet. After I had my son, I didn't have one headache. I didn't have one symptom of PMS, where I would get in a fight with my husband in the few days leading up to my cycle. I had no indication my cycle was coming. I used to know down to the day, because the day before my cycle, I'd have this excruciating back pain, and it would cause me to be keeled over in bed with this pain. And I knew my cycle was starting the next day. I was ruining my clothes because I had no indication when my cycle was coming. It was a lot less heavy. It was a lot closer together, the days. And, it radically changed how I approached the world, how I approached my relationships, how I got through things that were, hard, right? Conflict or contrast in my life. I was just a happier, brighter person. And prior to that, for 35 years, I've been walking around kind of just feeling worse than I should, right? Wondering, is this it? Is this all there is to life? And never getting that really restorative feeling that I feel every day now, no matter what's going on or how hard life gets. And so once I really felt that, and it's very palpable, that deep sense of well-being, I knew I had to gift this to other people. And it was hard, because it's hard to explain this concept to people who have never felt it before, and how it really is based on your lifestyle and you really can achieve it. And so I started in the pandemic, and I started with just like my mom and one other friend was like my first patient. And that really ended up being all it took, because I helped those people. And then I helped another and then another. And I realized that this was really my purpose. And now I get people coming in here who say, my week starts with you. This is how I gauge, the rest of my week. And they come in, they feel restored. And I know that I'm making a difference, and I felt it in my own life.
I love that. And that was actually kind of around when we met, was the pandemic. Now I wanted talk a little bit about your specific practice? Because obviously you are double board certified, you are a nutritionist, you have this wealth of knowledge, and you've left the quote unquote traditional Western world. But it sounds like you're still using a lot of these practices while also introducing more of the Eastern medicine, which we know works. And it's becoming more prevalent today. So in your specific practice today, how are you blending the two of those together for your patients?
Wonderful question. So because Western medicine, you go to medical school, they teach you all the things that are evidence-based. We know the science works. I'm a big fan of medicine when it's needed. And so because of that background, because I have my residency and a board certification in internal medicine, you can come into my practice and utilize that as me as a general practitioner for you. When you feel an ailment, if you need medicine, if you have the flu, all of those things, right? But also because of lifestyle medicine, because of what I've been through, that preventative health journey, I am so open to all of the alternative medicine routes. So I have a Chinese practitioner in my office. Of course, I do a lot of lifestyle counseling, and the lifestyle I counsel on does have a lot to do with evidence-based information. But I've also integrated a lot of mindset work, which we as a Western traditional bedside medicine culture should know how significant mindset is, because we understand the placebo effect. We don't put anything out on the market unless it's been measured against the mindset, right? And so I have really leaned into my practice about the positivity and the mindset and how effective the body can be at healing itself when you are aligned with that energy.
Beautiful. Are there any studies that blew your, like you and I both, like I love finding studies to back up the things that I already do and teach, but are there any studies that have stood out to you when it comes to the positive mindset or how to change your life that maybe people aren't aware of?
Yeah, I mean, I'm sure there's much more than what's coming to mind. Like you said, we love finding studies that, bring this to life. But yes, there's a couple that have come to the top of my mind. So there was a study of like custodial or housekeeping staff that showed that when they told them what they were doing in terms of, making beds or vacuuming and all of that kind of physical labor was good for their health, they had better health parameters at the end of the trial, as opposed to those people, the other half of the cohort where they said, no, what you're doing isn't enough for your, that physical activity isn't enough. You actually need to exercise above and beyond that. And then they didn't exercise above and beyond that, but their health parameters either got worse or stayed the same. So that mind shift for when we are deliberate about what's making us healthy is it actually heals the body. There's another study, which is so fascinating. So you tell somebody there's a cream that will help, it was a Yale researcher. So they put the same kind of histamine reaction in two different cohorts. And they were like, this is going to help you. And then they could see that the ones that said, it's not going to help, it didn't help. And it got smaller when they said it did. And then they even did that same study with the cream, but they had the actual practitioner be somebody that was either like it said medical student or like physician, and somebody who like gave no eye contact versus somebody who was really empathetic. And that even improved the healing even more. So it's about knowing what is healthy, knowing what you're doing is helping you out, and that the people who are telling you the information actually care about you. I mean, and those things are less tangible than a lot of the medicines we prescribe, but they might be just as, or if not more, healing and more powerful for our health, right? It's like, if I didn't incorporate that, I would be missing a huge aspect of healing. And so I wish more physicians would incorporate that into their practice.
I couldn't agree more. And this is a little bit off kilter, but there was a study done in the University of Istanbul that I love this study. So the professor over a period of like 5 years would give her students a t-shirt that had a Superman like logo embolism. And then she would go and do various tests. And I can't remember off the top of my head which ones they were, but time and time and time again, every single student who wore a t-shirt that had a Superman felt more confident just from wearing a shirt with a Superman logo on it. And they actually felt physically stronger. And so it really goes to the power of the mind and what you're saying. And there was another study too, and I don't remember what it is exactly at this moment, but it was done about if someone is given they have a terminal illness and the doctor says, you have 3 months to live, let's start getting everything in place, versus those who they said, look, this is terminal. We don't know how long you have, but they instilled a lot more hope. The results were so drastic between the two sets of patients, of those who were told, you have X amount of time. Well, it's taking all the hope versus those who don't. And so I love that you're bringing in the mindset. Like, we know it's also like, it's mind boggling to me a little bit. It's like, we know the power of joy and hope. And we know that when you're feeling shitty about yourself, that, life becomes worse. And so it's always fascinating to me that more doctors don't instill that in their patients. And it's hard because I'm sure, like you, like every other doctor, like you go through 8 years of college or not, whatever medical school, to help people. Right. And then it's like the system as a whole feels like it is quite broken, where you get like 15 minutes with your doctor and they're like, hey, what's wrong with this? Okay. Bye. And I feel like it's such an opportunity for new things, which is why I so love what you're doing. Now, what I actually wanted to talk about, something interesting that you had mentioned previously off camera, was you were saying that or maybe you mentioned it on camera, but you were mentioning that you were flagged like as normal when it came to you're feeling like shit. And actually something that you said too is it felt normal, right? And I think there's so many people just walking around day to day that don't even know what it feels like to actually feel good in the body. But I want to know, like, as from a doctor's standpoint, how is this happening that things are getting flagged as normal when you're literally walking and being like, I have pain, my periods suck, I have headaches? How is this happening, Brooke?
Well, I think it takes, there's a culture of medicine, right? So first off, the culture is to diagnose something, to put a label on it so you know how to treat it moving forward. And I think that, that's served the medical community very well for certain things. And, I think against liability, that's helpful. And there's all kinds of reasons that has been the culture, and that culture persists. And I think that the intention as well. And I love all my, my medical colleagues, and I love what they provide. But I think where we miss the mark is that a lot of what we screen for, we don't do tests unless we know we're going to treat something. And a lot of what we screen for can't be caught on a test, right? Like a lot of what's going on underneath that's subclinical. It's, if you have a minor imbalance, you can't see it on a lab. Or, if there's pain somewhere and it's not showing up on x-ray, it doesn't mean it's not real. And unfortunately, there's a little bit of culture in medicine that, labels people as anxious or crazy if, what persists, we can't find, as if we are the end all be all, and we get to say whether or not you actually have an illness, right? But I have taken being away from traditional bedside medicine, I have taken a totally different approach to that. Everybody's somatic symptoms are real. They're absolutely 100% real. And whether that's because of the mindset, or if it's just something that's abnormal, because we have a very intricately laced endocrine system where one small disruption can disrupt the whole system. And so then that can lead to irregular periods or pain with periods, but it might have been due because you have too much cortisol in the system and stress and not sleeping well and things like that. So that wouldn't have shown up on a lab. But if we can start to talk about your lifestyle, get those preventative things, kind of the foundation, that basis for a good lifestyle intact, we can start to affect all of the systems in that's just the root cause. That's never going to show up on a lab. And that's just not how we were taught going through medical school that's just not how we were taught going through medical school to treat patients.
Interesting. It really makes me think, actually, just in my own journey of, I have battled, just what have I not, I feel like at this point, but growing up, I was having crazy bad stomach pains at 7 years old, and I was hospitalized. And I remember them doing just really invasive tests. And I know that medicine has obviously progressed a lot since when I was 7. And then when I was 13, again, the stomach pains were so bad. And they put me on like the highest dose, like antacid for like an adult, and then put me on the brat diet. And then at 16, I'm getting recurring headaches every single day. When school would end, I would get this headache. So I would take 4 Advils a day for an entire year. And I had such bad chronic acne from 11 and on my back and my butt, and it was scarring. And so I went on Accutane, and I went on Accutane 3 times to where my dermatologist, and everything else trying that too, to where my dermatologist actually said, Nikki, you might just be one of the unlucky ones. You might have to just go on and off this for the rest of your life. And what I heard you say, and what's so relevant to me and like what I teach now and why we have such similar views, is nobody asked me, how are you? How are you feeling? What's going on at home? What's going on at school? Because now that I've done so much of this healing work, I'm like, yeah, my parents getting divorced and things of that, like that was greatly affecting me. School, horrible experience in high school, that greatly affected me. And so I think it is so important. And that's why I love what you're doing, to really make people, your patients, feel seen and understood, where it's not just, okay, here, I'm coming in, get the diagnosis, get the pill, and walk on your way. And am I hearing you correct? And that's really what you do in your practice?
Yes, you are so right. And I want to say first, do not ignore those alarm signals from the body, right? Those alarm signals that show up as symptoms, we could give you pain medicine, we can give you antacids, to your point, and we can make those symptoms go away so that the system itself isn't alarming. But if you have an alarm, you still got to go find the root cause so it doesn't happen again, right? So don't ignore the alarm systems, because when you have inflammation in one area and that's showing up in your gut or in your brain or in your joints, it is everywhere. It's throughout the whole body, and that's creating chronic disease, and that's creating a shorter lifespan, and it's aging you. So those alarm signals, although we can treat them and we can give you symptom relief, we still have to treat the root cause. We still have to go through the preventative approach. And then for me, I did that. I went through I'm going to do it this way, and I'm going to make sure I give you all the evidence. And then people were doing those things and still not getting better. And that's where the mindset is so important. And there's actually a physician, really, really, respected physician, Dr. Will Bolsewicz. He wrote a best-selling book, Fiber Fueled. And he will say, like, I've had patients who we get on the right diet and we change everything, and then it'll be like the stress at work and getting rid of that stimulus that will actually end up being the thing that heals them, right? So it's so true. And you're right. That's absolutely what I do in my practice, to try and get to those things, because it's not always, just about getting the medicine and making a pretty box of a diagnosis. It doesn't always fit that way.
Yeah. I couldn't agree more on that. And it's incredible that you're doing this. And I can only just hope that over the next few years, this expands more and more, because I feel like in today's day and age, people feel less seen, less heard, less understood than ever. And it's like, these are such beautiful opportunities in every encounter we have in life to really make someone feel understood, so that it's like, it's not just the symptom you have, like, let's go to that root cause. But I want to switch gears a little bit. And seeing as I'm talking to an expert, I am no expert in this field, but I want to talk about Ozempic, because it is everywhere. It's on TikTok. You have celebrities that have come out and are saying they're on it. You have a lot of celebrities who just magically lost weight and attributed it to, hey, I just started working out. I'm like, bullshit. But I want to talk about Ozempic and really the rise of it, and we'll kind of dissect it a little bit. I want to hear your specific thoughts being a doctor about this drug or this class of drugs.
Absolutely. And I think this is a really great conversation to be having because it is so much in the mainstream media. And I think that a lot of the stigma around it, oh, you shouldn't be taking that, or like, oh, that's like a shortcut or whatever, comes from not seeing it clinically in the patients that, need to be on it and seeing the actual health benefits that it provides. I mean, when people come in and they are losing weight and they are lowering their cholesterol and their blood pressure is improving, and they lower their uric acid, all of these things are improving their lifespan and their chronic disease risk, and their confidence is up and they can maintain because they want to get out and exercise. Their back pain is going away. Their joints feel better. It is such an effective tool for so many things that ail our society. And so I'm so proud that I offer it and that I monitor my patients, and I, with the proper diet and the proper exercise and the proper counseling, it is such an effective medication. And I love it for those reasons. Now,
I was wondering if there was going to be a however.
It does have its side effects, right? And you have to know that you're a good candidate for it, right? You can't be too underweight and then be in an underweight category. Once you get to your goal, that will increase your risk of disease and illness, and it will lower your immunity. And those things are very serious. And I think that some people take them in not a healthy way. And that's the reality of things. It's not the first diet drug out there, phentermine, and people take Adderall for these reasons too. So I don't think we have to vilify something that's helping a lot of people because some people decide to take it in a bad way, in a way that isn't helpful or isn't healthy. Because that happens, right? But there's also side effects in a patient population who really does need it. And so you have to have the right practitioner providing the right counseling, I believe, and you have to be on the right diet. It's a commitment because you really shouldn't be drinking alcohol on it. You should be watching what you eat. You should have a lot of plant-based foods. There's, a lot of stimulation from the pancreas and the gallbladder when you're eating the wrong foods that can lead to pancreatitis or gallbladder sludge, which can end up being medical emergencies. There are certain cancers that you can't have in your family to have this. So if you're just going to your traditional, med spa and you're just getting the shot every month and you're not monitoring your bowel movements that could lead to small bowel obstruction or anything like that, you are putting yourself at a higher risk for complications than if you were seeing a practitioner who can explain all these things and monitor your symptoms. So it's a double-edged sword. I love it for all of the great reasons. And, it concerns me for other reasons.
When it comes to this drug, like I have two thoughts on it, because in one sense, I'm like, America is the fattest nation in the country and obesity rates keep going up. And it's like, so now we have this miracle drug. And I know I was listening to this really interesting podcast episode on NPR about it. And, so on one side, we have this and it does work. And I fully agree with you that those people who like nothing else has worked and it's really getting that quality of life back. Right. So in one sense, I'm like, yes, I love that this is available. And then on the other side, I would say there's kind of two other of the like more negative sides that I look at where you do have a lot of people that are doing it just like, oh, okay, like I want to be skinny now and I'm going to just, there's this miracle thing. I'm just going to take it, voila. And it's like, so what kind of hits my mind on this is clearly we are doing something wrong as a nation. If this many people are obese, if this many people have type 2 diabetes, if this many people are going on Ozempic, why are we not going to the root? Like, this kind of feels like we're treating something rather than going to the root of, like, because in this NPR thing, it was like this woman saying, oh, like, I've tried every single diet. And it's like, well, clearly it's not just about the diet, right? And as you've experienced in the Ultimate Transformation Program, like, we have to understand why you're doing what you're doing. And so I understand the positive benefits you're saying. As a doctor coming from, like, I'm trying to like formulate the question here, but what are your thoughts then on, because we're talking about the root cause of things, not just the symptoms. So what are your thoughts on that, and the fact that so many people are on it when there's clearly a bigger problem that
Right.
so many people need it? Does that make sense?
Yes, there's so many thoughts going through my head. Like, the root cause has a lot to do with capitalism and industry and money flow. And it's going to be really hard to combat people who are trying to put food into our food system at a cheap, low quality, in order to, and to really to change their ethos to say, only feed us healthy stuff at the risk of what's going into your pocket. That's going to take that's just, I don't see that happening anytime soon. I wish it would happen. I really do. And I want to hold out hope for that good people in the world will make that happen and keep pushing towards that. And then, I have people come into my office, and I get what you're saying. It's like, why not push the lifestyle to the ends of the earth before giving them this tool? And it's really hard. Your body biologically holds on to weight. After you lose about 5% of your weight, your body, it starts to lower your BMR, your thyroid hormone goes down. It really has all these checkpoints to keep you from losing those energy stores, which is a very primitive part of our body's biology. And it's something that is antagonistic to our survival now. So we call it antagonistic pleiotropy, where something that was good for our survival in a primitive stage, now in modern times, is not advantageous for us anymore. And so to have this tool to overcome that, while also, like I said, proper nutrition counseling and things like that, I think is a good, I think that's a good balance of using both of those things. You want to use the tools that are available. But I will say to you, like, I have patients who come in on Ozempic or semaglutide, and they have plateaued when I really think, like, they should not have plateaued this week on this medication. And I'll dive a little deeper into their lives. And maybe they're really stressed at work, or they're a lawyer and they have a big case coming up. And we will sit and do meditations, and we'll talk about their stress. And I want to give them a well-rounded lifestyle. I want to get them off the medication. I don't want them to have to be on this for maintenance forever and ever. But I think that you have to be open to it as a tool, as a practitioner in my position.
And is this drug, or these class of drugs, do you actually have to stay on it? Because the NPR episode I was listening to, it was saying that those in studies that they'd done, when they came off of it, not only gained the weight back, if they didn't implement what you're saying, the lifestyle changes as well, which, let's be real, so many people don't, but they would gain the weight back, and they would actually gain even more weight back. So is that something, like, if you start it, you take it, you make one or two small changes, but not a massive overhaul on your life, will you gain that weight back that you've seen?
That's not been the case in the trial that that was done by the company, because the company that owns Ozempic and Wegovy, their intent was for the people to be on it for the long term. And so I'm not saying that study doesn't exist. I just probably haven't seen it. Maybe I need to, brush up on that. But the company actually, after the initial trials, did the trial where they had the patients on the same treatment protocol for the 68 weeks like they had in the trial, right? We know that when you're ramping up the dose, you lose the most weight and then it plateaus. So then they tried to take people off of the medication after 68 weeks. And yes, they gained back a certain percentage of the weight. But when they compared it to the placebo group, they didn't gain all of their weight back, right? They didn't actually weigh more after they followed him again for 68 weeks. So over a year of time after they came off of the medication, which they had been on for 68 weeks, and they didn't weigh what they had weighed when they started the trial. So it is helpful to be on it, right? You're obviously going to gain weight when you come off of it. Your hunger comes back to some degree, but it is still advantageous to be on it if you plan to stop it, because your weight actually does stay down after the 68 weeks, which is not what the company wanted to show, truly.
Right, because they want you to be on it, I'm sure, for life. Who is a good candidate for Ozempic or semaglutide, and who is not a good candidate for it?
So the great candidates are the ones who we see obviously are in an overweight or obese category. I will say the overweight category in my clinical experience does better, right? Sometimes it's harder to treat the obese category. And I think for the reasons I said, the biology, our body wants to hold on to those stores. So you get under a percentage of weight loss, you stagnate a little quicker. And, but nevertheless, they have more to lose. And so it's very important for them to use this tool. Anybody who has a comorbidity, right? Whether it's pre-diabetic, diabetic, high cholesterol, high blood pressure, things like that. This is a really good tool because we already know the risks of having this excess weight on. We already know the risks of those risk factors. And so we're willing to accept some of the risks with this medication in order to bypass some of those risk factors and get you at a healthy weight. And then people who aren't ideal are people who are in a low weight or like a low normal weight category. We don't want to ever push somebody into an underweight category. That has its own risks in of itself, right? There's certain things, and you'll hear, like, if you've ever had a history of a goiter or a medullary thyroid carcinoma, or if you're trying to become pregnant, there's things that the manufacturer of Ozempic lists as absolute contraindications that we know from trial just should not ever be implemented into those people. We know that arthritis is, there's 100% relapse of symptoms, people with rheumatoid arthritis at 6 months.
Interesting. Why is that? Do you know?
Well, I don't know if it's because they're coming off the medicine and they're having some increased inflammation because, their diet is poor, or they're having, increased glucose in their blood, that blood sugar is spiking again. I don't know the exact answer, but we know that there is some relapse with rheumatoid arthritis. There's studies, everything's going to be studied on this medicine because it's so prevalent. I was just reading, I have a patient who's interested but has atrial fibrillation, and the manufacturers are doing a study now on patients with atrial fibrillation. We're not supposed to have those results until 2027 will be primary results, and then we won't know the complete results till 2028. So like I said, clinical medicine actually, lags the research, but there's all kinds of nuances to the medicine. But I think, being overweight and having comorbidities versus being underweight and being relatively healthy. And there's other things that you can do to stabilize your blood sugar, in that kind of underweight category if you're not a candidate for this weight loss medication.
So that's all really, really interesting to know. And I'm still under the camp of like, let's do all the things before that, so it doesn't become the clutch, let's say, or just the pill that's getting, or, whatever it might be. So let's just say someone is coming to you or anyone listening, and they're like, I just don't feel great, right? I'm overweight. I can't lose weight. Or when I say overweight, they're carrying weight they don't like, or they're having headaches or symptomatic. What are like your top 5 things that you would sit down and say, do this? Is it a supplement that you would recommend? Is it, starting meditation? What are the 5 biggest tips that someone just starting today could do?
Oh, yeah. Absolutely. I'm all for working on the lifestyle first, because if we give you this tool and I have 2 groups of people that get on this medicine. Ones that really just lean into the medicine, they change nothing about their lifestyle. And the ones that are just like, okay, this is going to take away some of my cravings. I'm going to lean into lifestyle so I can make this a lifelong change for myself. And obviously those people have better progress and things like that. So I love working on those things first and setting that ground foundation. I mean, it's so empowering to be able to do it on your own. And those things would be sleep. Like sleep is a huge foundation for weight loss. If you're not sleeping well, your body's going to hold on to excess weight. It just puts it into this stressed category, right? Where anytime we're overly stressed, we are going to be holding on to weight, right? So the reason I'm saying stress because you're not sleeping well is because your cortisol is up. And so that's the same hormone imbalance when you do have, significant stress in your life. So that's the next thing, right? You say meditation. Meditation is an excellent tool. I meditate with my patients frequently in the office because sometimes they go home and meditate and they actually don't even know how deeply they can relax because they kind of have this baseline of sympathetic tone and they get it down a little bit and it feels a little better. But like when they get in my office, they feel my energy and it helps to get them really, really relaxed. And so I love meditating with a patient to give them a baseline. So I would say, make sure you protect your sleep, meditate, reducing the amount of saturated fat in your diet. And the biggest components of saturated fat in the Western diet are animal meats and dairy. So lowering those. Alcohol can increase your cholesterol too. So that's another big one. If you're having quite a bit of alcohol, if you have high cholesterol, that's something to really consider lowering. And then exercise. And we all know it. I mean, these things they're not, some groundbreaking things, but a lot of times you need the accountability and you need some of the education behind it and you need to hear it over and over again. And then you got to believe in yourself and want this for yourself. Like I would say again, to your other question, you're not a good candidate for the medication if you're not a place to be working on your health, right? This is not just like, a miracle pill. That's not what it is. Yes, it will help you lose weight in the interim, but you'll do a lot better when you're working on yourself. And not only will you do better and have better progress in the medication, but you'll have a better long-term success when you want to come off of it. So yeah, I mean, there's nothing groundbreaking I'm saying, but I do feel like it's groundbreaking when I have patients in my office and I talk to them about the hormones of sleep or adenosine as your sleep pressure hormone and how they understand how that works when they're looking at their blue light or if they're going to sleep too early and staying in bed too late and things like that. They get the education around why these things work the way they do. And it sends light bulbs to say, okay, this is why it makes a difference. I can't be complacent. I need to design my life in such a way that optimizes all of these factors to promote my health.
Amen. Amen. And but, and I'm not saying, but from what you're saying, I'm saying, and it's so funny because here we are saying, prioritize your sleep and protect your sleep. I love how you put that, meditation, correct diet, like the things you're saying are so not groundbreaking. And they have been said over and over and over. Every single person on this planet knows you need to move the body. And yet it's kind of what you said. It's like, you need to hear it in a variety of different ways. Like I have women come into the Ultimate Transformation Program and I'll say something, they've heard it before, but it's that aha, that click. And then it's like, oh, how interesting. A blueberry is actually good for me. And it's like, haven't you been told this like 5 million times? But I have so much love and compassion because I was the same. It's like, you don't get it until you get it. And so it's like not judging yourself. So it's, while you're saying nothing, quote unquote, groundbreaking, I love that you're saying that actually these are just the baseline things and it doesn't need to be complicated. But you said something about hormones and sleep. So I get asked quite a bit about hormones. I've never had someone on the show either that has the qualification to talk about this. So can we do a little bit of an unpacking of women's hormones? What do we need to know? When is it, alarm bells? And what do we do to help our hormones or figure them out as women?
Okay, that's a big question. It could be an episode all of it itself. And you should definitely have a reproductive endocrinologist who has done like an actual residency or, like an actual fellowship or training in this, come on and talk about the specific nuances. But I absolutely can speak to it. So I think the reason it's so big is because, just like we're talking about Ozempic, we get a lot of these symptoms when we hit menopause and our hormones are no longer in balance. And so it's been a little bit of a scapegoat for us to say, oh, my hormones are just out of whack. I think that's the reason I can't get the weight loss, or that's why I'm not sleeping well. Or so I want to kind of back up and say yes, your hormones are probably out of whack, but it's not your hormones causing the problem, right? It's the lifestyle causing the problem. And then when we think about our hormones, we have these certain cascades, right? Our hypothalamus to our pituitary to our ovaries, right? But then we also have axes from our hypothalamus to our pituitary to our adrenal glands, and our hypothalamus to our pituitary to our thyroid, right? And then these are also intricately laced from hormones that come from the gut and our insulin and our glucose control. And so just to sit here and say, these are the hormones you need to know, this is how it works. And, if you do this one thing, these will all be in line. That would be really dumbing down the very, very, very intricate system that is the endocrine system, right? And I want to say that if you just like Google all of the hormones of the endocrine system, it would be overwhelming, some of these graphs that you would see.
I'm just going to like quickly interrupt, because what's so funny is even as you're talking, my mind is like, what? And that's why, like, it's so funny, because when women come to me and they're like, oh, my hormones are off balance. And just as to your point, it's like, well, okay, yes. And it's probably not because of the hormone itself. It's probably something else. And so because I almost want to like dumb it down a little bit of what should a woman know? Like, what are the maybe baseline things that we should know about our body when it comes to our hormones? And how can we tell when our hormones are maybe quote unquote off?
Okay. It's hard, right? It's so hard because those symptoms, those vague symptoms that say our hormones are off, or, we're now entering menopause, right? They can also be thrown off by lifestyle. So let me just say this. When your periods are no longer regular, right? When your periods have started to become like more spaced out, when you're having certain spotting, and that not every spotting thing is just a total derangement in your hormones, but it is hormone driven, right? So those things can happen. If you're having obviously hot flashes, sometimes insomnia, right? Fatigue, right? I'm telling you these things, and how vague they are, can be signs of hormones and hormone imbalances, right? Weight gain. But when you go talk to your doctor about it, they can get these really expensive hormone tests. And like we said earlier, unless you're working on the foundation, right, you're not going to effectively change the hormones. If you have no testosterone, we give you testosterone, your energy is going to go through the roof. But we haven't addressed like the underlying problem. And then, of course, like the progesterone and the estrogen, those can be out of whack and they can be dwindling, maybe prior to where you think you're supposed to be going into menopause. And knowing that information is empowering. But if you just give yourself medication, then you've accepted, okay, I'm going into early menopause and I'm going to just replace my hormones, which is totally acceptable and probably beneficial to your bone health and to your symptomatology and to your brain health, right? As we lose estrogen, we lose bone mass, we start to age faster, right? We want these things in our bodies, but you have to think that, why am I going into early menopause? Is there anything that I can do to start to push menopause out later? And there absolutely is. Just like with endometriosis, when you have really heavy, painful periods that cause, abnormal symptoms and PMDD and diarrhea, these things often get just pushed to the side, but a lot of it is inflammation driven. So are you having a lot of processed foods? Are you eating hyper-inflammatory meats, right? We know that poultry is super inflammatory to the system, and everybody thinks it's the healthiest, leanest protein, and it's just a misnomer. It's not true. And so there's this conversation could go on forever. There's so many things.
I mean, it is so fascinating. And I do appreciate what you're saying, because I also get women coming to me and being like, hey, Nikki, like, and I am in no way, shape, or form a doctor. I do not ever give medical advice. Everything that I share on this podcast or on Instagram is based on something that I have learned, I've tried, I've implemented. So I find it funny when women come to me and they're like, hey, so what do you think about the hormones and this? And I've heard about testosterone. And I do think that there is a time and a place for a woman to do that. But just as you're saying, it's like, unless you're going in and speaking to you in an actual consultation, it's like, yeah, your testosterone might be low and you're having those side effects of whatever that might be. But is it, I love actually what we just keep coming back to, which is RootedFemme. It's what is the actual root of the symptoms that you're having, because it might not be the hormones after all. As you said, it might be the food, which is causing inflammation. And that's where, my program UTP, like, I love so much because we go to the root of that so much. And then, women lose crazy amounts of weight on the program without even trying, and they see their life change. And so I so honor and respect that you are so knowledgeable and you are so practical and realistic, which I get that for some people, it's not what they're looking for. They want to be told, go on progesterone, go on estrogen, go on this, instead of going into this deep dive of like, you have to trust your own body and you have to start learning your own body. And that's really what I'm hearing. Am I correct in kind of how I sum that up?
Right. And honestly, there is a space for hormone replacement. And, I am a huge advocate for that when it's needed, right? But you want to make sure it's in a normal fashion, right? That actually is your body going into those phases in life versus, you should be in your prime. You shouldn't be going through this too early. Let's talk about your life. So yes, you are totally correct. And I mean, I have to say about the UTP, like, people just like losing weight. Like, I remember starting with you and I'm like, I'm not here for the weight loss. Like, but if I could lose 10 pounds, I feel like I could do anything because it's just been with me for a while. And then I started to unpack some of these things in this spiritual onion you talk about. And you're like you say, it was like, I got to that goal weight without having to think about it. It wasn't even like I had already changed my diet. I was already eating a clean diet, but I was holding on to this little excess weight for other reasons, right? It was almost like I was self-sabotaging because that was like the keys were somewhere else. You know what I mean?
Absolutely. And actually, just we'll go on a really, really quick tangent because I don't want this to be a promo of my program, but I am curious as to why you are already a doctor, nutritionist, you know what to do, you teach people. What was it for you, the driving factor to seek outside help on this program, for example?
I had, kind of spiritual intuitive business coaches before. And really it was very expansive for me. It felt like very aligned with where I needed to go. And I was trusting, right? I was in a very like, whatever's meant for me is going to show up for me. And I think, on our first like consult or, our first discovery call, you said something like that. You said, when people need this, they kind of show up. And it just resonated with me. It was, there was something missing. I was feeling very stuck. And I just needed to get over some humps. I needed to get through some stepping stones, right? And I learned, and I didn't understand. I think I was kind of blind going into it. I'm like, what am I doing? Like, I didn't know the answer. And then the answers were coming to me. Like, this is why I signed up for this, because of, the concepts that you were introducing. I mean, those concepts really, really changed my life. and in a huge way. I mean, I was able to get over some, very toxic friendships, and I was able to expand my business in radical ways. And I was able to reach my patients in a lot more profound ways after experiencing the UTP, really.
I love
I'm
it.
so grateful for it, but it was very aligned. It was the universe.
I love that. And I, having recently spoke at your event, something that really stood out to me was those in your life, your friends that I got to meet, and you have an amazing community of women. I was so just enamored with every single person that I met who came to the retreat. But people were coming up to me, both your clients and also friends, and just saying, wow, the changes that I've seen in Brooke from doing your program, Nikki, it's been incredible. And that's really, I think, that's the passion and purpose that I have of doing like this podcast, for example, or even doing my program, because it's, if I can have an effect, just as I'm sure this is why you became a doctor, of if I can have a positive effect on someone in even just the smallest place in their life, it makes me feel like I went through some of the suffering that I did so that I can help you. And it's like, it just becomes this, we're giving back. And that's really what the world is about. So I'm grateful that I met you and got to guide you through the program. But I want to end with two last, we could talk for ages, and I'll definitely have you back. But I would like to know, when we talk about supplements, and not just supplements, but there's superfoods, right? There's maca powder, there's turmeric, there's spirulina. Then we have like a daily, multi-daily vitamin. Like I had Dr. Daniel Amen on the show, and he said a multivitamin is the number one supplement that you should be having. Now, I was listening to you on another podcast where you were saying, yes, they are good. And there's going to be different kind of factors that play into that. So if you had to sum up, just blanket statement for everyone, what are like 3 to 5 supplements or superfoods that you're like, just, we don't need to talk about doses or anything, but like, just put this in your life, start having this?
Well, okay, I have to really preface this with like, talk to your provider, right? This is not direct medical advice. Everybody's nuanced and different, but I do agree with Dr. Amen. I mean, a multivitamin, and I think the statement I made on the podcast you were listening to is something that I truly believe. In the absence of a nutritional deficiency, we don't need supplements. But
yeah, that's what you were saying about it. Yeah.
The problem is we just don't have a great diet as a whole, as a population. And I think for most people, a multivitamin is a pretty low, low adverse risk profile, and has a lot of what we need that we might not be getting from our diet. Now, let me say this, go see your provider. If you have kidney problems, you're not going to be able to process these things or excrete them if they become in excess, and you can get toxicities from supplements. Okay. The other thing is a vitamin D. I think that, again, talk to your provider, but this is, something we get from the sun. We spend a lot of time indoors. I think that the risk of skin cancer is real. People use a lot of sunscreen. You can have your vitamin D checked, but I do think that vitamin D in general is pretty good for a population. Like 1,000 IUs is really, where I would start. But again, talk to your provider, get your blood work drawn. Another thing that's really low risk is like magnesium. People take it at night to help them sleep, to help them go to the bathroom. You can have your magnesium checked pretty easily. It's not a common deficiency, but some people get a lot of benefit from it.
Wait,
omega.
Quick question on that one, the magnesiums, because there are different forms. There's like magnesium citrate. I don't know if I'm saying that right. There's a few others, and I've read and heard that there are certain forms that we should be taking for, sleep versus going to the bathroom. Is there one specific magnesium? I don't even know what it would be called, but that we should be taking?
Well, so magnesium citrate usually comes in a liquid form. It has that citrate portion of it is very laxative. So it's going to make your bowels move quite a bit. It's going to be irritating to the bowels, but also magnesium in itself is good for bowels, but you can get like a malate form that you can take at night. That's a lot more soothing to the gut. So it depends on what you're needing, and talk to your provider, because that's very nuanced too.
Got it.
And then I
yeah.
say like omega-3, like, even the studies that aren't as like convincing for a reduction in heart disease risk, which most of them are very convincing for that. We know that like in the typical Western diet, we don't get a whole lot of omega-3 and it is beneficial. So that's a pretty low risk one. I take one myself.
Amazing. And the last question that I have, and I leave every guest with, is what are your top 3 tips of everything we've talked about or anything we didn't talk about? What are your top 3 tips for someone to live a sharper life?
Meditation is the top. I don't go a day without meditation anymore since I discovered what it does for me and centers me and puts me in that space to kind of detach emotionally from things that are coming in, to slow down those thoughts and realize those thoughts are, not always true. And our brain is just going constantly. And to be able to turn it off is such a gift. And I will say it's hard when you get started. I have so many patients that don't meditate and don't see the value of it because it's hard. It's a practice, right? So that would be my top, is to just get started as slowly and as minimal as you can. Start meditating. Move your body, right? Feel into your body, stretch your body. It has to carry you through your whole life. It's the only one you got. So you don't have to over exercise. I think it's, we get into this thought that it's all or nothing. If I'm not a bodybuilder, I don't have no place in the gym. And that's just not true. Your gym can be anywhere. Get on the floor, start moving your body, feel into it. Where are you tight? Can you increase your flexibility? Contract those muscles, get them moving. And the best exercise is the one you will do. So as light or as heavy as it is, just do something, move your body. And then more plants. That's all you have to remember about diet. Like if you're here and we just want to get you to here, and then we get you to here and get you to here, it's getting more variety of plants in your diet throughout your week will increase your gut microbiome. It will lower your inflammation. It's got medicinal components that you and I don't even know. Neither do the scientists. It's so the gifts of fruit and vegetables and foods from the earth is so healing for our bodies. Get more plants in your diet.
Beautiful. Well, just everything you shared. I think it was so down to earth and practical and yet easy to understand. And I just want to thank you for doing what you do. And it's so inspiring to see you doing this. And also, why I wanted to have you kind of share about your journey is just to let people know too, that the path that you're on isn't always going to be the path. The path might be taking you somewhere else. And you had to go through your residency and feeling like shit to actually get you to where you are now. And it's such a message of hope and inspiration for wherever you are in life right now. Everything will be okay if you're willing to look at your life and make some small changes, as I'm hearing you say. And, Brooke, I will link everything from your podcast to your mobile app, which you have. I'll link your website and Instagram in the show notes. And everyone, please go follow Brooke. She is just a force to be reckoned with. She is incredible. You are incredible. So Dr. Brooke Stubbs, thank you so much for being on the show today.
Thank you, Nikki. You are incredible.
I appreciate you. And until next week, here's to a sharper life.